Welcome, everybody, to the Mental Health Hour. Welcome to episode 85. Tonight is all about co-occurring disorders.
Mm-hmm.
Good evening to Mr. Med, Ray, Michael Joseph Murray, Uncle Rick, and everybody trickling in. It's good to see you all. Welcome again. And let's get into the content. Gemma, what's going on?
Still getting used to the 10 p.m. thing, but we'll be back to 11 next week. So we change our clocks at the weekend. So apologies in advance if I get any visitors in the room. I'm hoping I don't, but trying to get him to bed for 11 is hard enough. 10.
10.
We'll roll with it.
So you do your clocks go forward.
This weekend, yeah.
This weekend.
Yeah.
So back to normal next week.
Yeah.
Hello, E.G. Lyons. And hello, Craig. All right. So co-occurring disorders. This is obviously, I don't know, was this a viewer request?
I think so, yeah. It was in the list, so yeah, it was probably one.
We sprinkle those in as well. So if you haven't been to the bio link, we only promote it all the time. bio.link/TMHH. You can submit viewer requested shows. It does tend to work better than texting me because I always forget.
Yeah.
But that being said, co-occurring disorders. Mm-hmm. This is pretty, I guess, close to home for me. The long and short of it is, I mean, there's a big realm of what it could fall, what constitutes it.
Mm-hmm.
But the main, I guess, meat and potatoes of where it came about was having a diagnosed mental situation, illness, whatever you want to call it, and then on top of that, adding in the substance abuse disorder, and putting those two hand in hand, generally doesn't mesh. A substance use disorder on its own is plenty. But to add in the mental health aspect of things just makes it scarier. Because now, while you have this substance use disorder, whether it be genetic or, usually that's what it is. Addiction is a hereditary, well, at least alcoholism is hereditary. Mm-hmm. Now you've got mental health on top of it, and you're using that to mask your mental health issues. Like myself, we'll go with the depression. That seems to be my overwhelming problem as far as my diagnoses go. Anxiety is no drop in the bucket, but it's the depression that really fucking gets you, or at least me.
Mm-hmm.
Everybody can kind of tell when I'm not myself, or something's going on. I know, Gemma, you've spoke to it before. You can tell when there's something up with me.
Yeah.
So
I think you get to know the person and then know when there's a difference. Like, even if you don't say, you can just tell.
Yeah, I mean, we do this show every week. We talk on the phone. You got the planning that goes into it. There's quite a bit of time spent, so you get to know somebody.
Oh, yeah.
You get to know their personality, and you can in turn get to know when something's a bit off.
Mm.
Now, for me, I don't really recognize when things are off. It's not, I don't know how to properly describe it. It's not like I'm blind to it. I know when I don't feel, my normal self. I can tell when things are weighing, because that's what
Mm-hmm.
my depression feels like. It feels like uh, something, like there's just the weight of an elephant sitting on my shoulders,
Yeah,
dragging me into or drilling me into the ground.
yeah, I get that. It's
It's
like you feel it yourself, but you don't know that you're acting differently. So you feel
exactly,
different inside, but you don't feel you're acting differently in any other way.
yeah.
Mhm.
It I don't know if I try and work through it on my own, which I tend to do. That's kind of my go-to thing, is that
Yeah.
I don't need help. Even though I've been down this path and I know that I can't do this shit on my own. And I work a program that is surrounded by help. Um,
Mhm.
I still kind of want to feel like I can do some of it myself, if that makes sense. I'm sure you know what I'm talking about, as you
Oh
have
yeah.
your
I'm
diagnoses as well.
just the same. Like I've noticed with you, you tend to be a lot more quiet. Like you don't chat as much as you usually do. You're not as responsive to messages and things. And I'm just the same because you've got all this weight weighing down on you, and it takes away so much energy from you that even sometimes feeling like just sending a reply on a message is just exhausting. And like I know myself that I feel like if I'm replying to someone, it's going to be kind of half-assed, and they're going to know about it then that I'm not myself. So I just don't reply.
Right. Jim in Chicagoland in the house. Thanks for the 15 months. It is a pleasure, as always, to have the host of Catalyst on Wednesday nights here on Twitch
Mm.
joining us for another episode. And we'll get into Catalyst a little later on in the show, as we always do. Um, Michael Joseph Murray says, good subject. I know my addiction to drinking was self-medicating, but there's lots of other things going on mentally connected with to domestic violence I was going through during my marriage.
Mm.
So things like that, domestic violence and what have you, play a role into all of our mental health. It certainly takes um, away from happiness.
Yeah, yeah.
And with a diagnosis of depression, or hitting somewhere on the depression scale, I'm just using depression right now because that's what I'm most familiar with.
Mm-hmm.
Um, of course, it was my first thought to turn to my good friend, the bottle, which was already a problem in and of itself, but now we're intermingling the two, bringing on the co-occurring disorders,
Mm-hmm.
which is exactly what we are discussing this evening. Um, so mixing the two of those together certainly adds to the magnitude of how much I was drinking. It adds to the magnitude of the depression I felt, um, because those two things together are working against each other. Uh, if I mean, I've said it on the show before, but um, my drinking, like I didn't realize until sobriety, excuse me, until sobriety, that my drinking was depressing me further, because in sobriety, I can feel the difference of my mood. I still get depressed. That's something that I'll have for the rest of my life. Um, but the drinking was making it so horrible, or so much more intense, and I didn't realize that. Alcohol is a depressant, um, more than just the sense of it depressing your bodily systems, your functions, and all that. It depresses you mentally as well, and it drilled me into the ground just like depression does. And like I said, I didn't realize that fully until I was sober for a little while, and I could feel a complete difference in how I woke up in the morning. I never really got a hangover when I was drinking, but I woke up feeling just as depressed, if not more, than the day before.
Mm-hmm.
Um, Gemma, have you tied in? I mean, and it doesn't, I guess it doesn't just have to be alcohol, but you can speak on alcohol if you want. Have you tied that in with trying to mask or um,
Oh
self
yeah.
medicate for?
Um, yeah, I used to actually take overdoses to get through it, like pain relief, but a lot too many painkillers, thinking it would help. I did used to, like, not to the point where it was an alcohol problem, but I did used to drink a lot more than I would have liked at one point. It never became a problem, but the intention was to get drunk enough to just pass out, to go to sleep, because I wasn't sleeping very well. And that was my intention, because I'd go through the stages of getting stupid with alcohol and then just crash out for hours. But also the problems with food, and I found that it made that worse as well with my depression. I would eat and I would binge eat junk food and then make myself sick. And that would get a lot worse as well with as the depression increased, when my bulimia and anorexia were in full swing. That would certainly kick in, and then the self-harming. It was like at my worst time, I was literally doing everything in one go, just to try and keep going and push the depression as far out of my head as I could. But it was actually making it worse, because you'd have the peaks and troughs, but then when you came down from it, you would come way down from it.
It comes kind of full
Kind of,
circle.
yeah, crashing down.
It
So
does. It
yeah,
makes a vicious loop
oh yeah.
of
And then you're
depression.
back to square one, and then starting to try and self-medicate again, and just getting out of it.
Um, Another thing that is a very common nowadays, a very common um, mental health issue that plays into co-occurring disorders is ADHD. Uh,
Mm-hmm.
this is another thing that I struggle with. Not a lot I knew about in the beginning when I was first getting the help I needed. I had to learn uh, not only about depression and why I was depressed and what the hell was going on, but also this thing called ADHD, which I've always known I've had. I've been diagnosed with it forever, but
Mm-hmm.
I've never really realized what it does uh, to you inside,
Mm-hmm.
or what you try and do to maybe subconsciously try and do to make up for this issue.
Mm-hmm.
A lot of folks with ADHD are substance or are also using substance um, to try and help them help themselves, if that makes sense. Um, it's not it's not exactly masking like it is for depression, but it's
Mhm.
trying to, as I always said, and maybe my depression was not the thing to lead off with here. Maybe it is the ADHD, because I've always said that I drank to feel normal,
Yeah.
and that's more leaning ADHD. Um, my brain is always fuzzy, and when I was drinking, I could unfrazzle it. I could unfuzz it. I felt
Mhm.
like I was thinking clearly. I felt like I was focused. I felt like I was getting things done. I felt organized. I felt
Yeah.
into shit, like going to the store or doing laundry or just simple tasks. I was more into it. I was more productive um, when I was drinking. And
Mhm.
I talk about my drinking on here a lot. I don't know how many times I've said the root of it like this. And I was not a blackout drinker. I was not a get drunk drinker. I was a start early, reach a optimal level of clarity for me, and then maintain that shit all day long. So
Mhm.
I 100% was self-medicating, and it was probably 100%. Well, it wasn't 100%, but it was a lot to do with this ADHD.
So you were doing that to be able to function then, really?
Yeah,
Yeah.
and it felt normal.
Mhm.
So now we take this away. Now I've destroyed my pancreas, and I've not my liver and all that was in the trash. But I literally can't drink anymore. My pancreas can't do it anymore. If I want to live a full life, I need my pancreas, and it's called it time to quit. Um, so now I take this away because I do want to live. I do want to be here.
Mhm.
Um,
And have you found like alternatives? Obviously, because you can't have the alcohol for managing with
it's a
like the
lot of
ADHD.
trial and error things.
I mean, I know I'm not diagnosed with it, but I know when we've discussed it and stuff, I recognize a lot of traits. Like then every single day, I will start a million tasks and complete nothing because I'll go and do something and then I'll be like, "Ooh, I haven't done that," and then I'll move on and move on and move on,
It is not
and
hard,
it's
at least here in the States. I can't speak for healthcare in the UK,
mm-mm.
but it is not hard at all to get a diagnosis of ADHD.
Oh, it's impossible here. Like seriously, I'm going through it all with Thomas at the moment, and it is just ridiculously insane.
It's
Um,
extremely difficult to get treatment for it. Um,
mhm.
all of our ADHD medications are on a national shortage right now, probably from the rising popularity of them and them being a controlled dangerous substance, et cetera,
Is
et
it
cetera.
Ritalin?
Um, I mean, Adderall has always been the college uh, goer's best friend for late night study sessions and whatnot. But
Mhm.
it is getting more and more. There are more and more diagnoses coming out with. You're increasing that pool of folks that need to draw from this medication,
Mhm.
and so we're in a national shortage. Certainly, there's financial stuff that go into that. The highest bidder, and there's also COVID has effed. We're still feeling the uh, effects of that rippling through the
I think it's
medical
going to be a
field.
long time before we fully
So
get over that,
it's
if
not
ever.
just folks getting prescriptions that has caused this national shortage. There's a lot more to it.
Mhm.
Excuse me. God damn, I don't know what's wrong with my throat tonight. But um, so there's ADHD medications, and they help. That they do a world of good for me. I myself am on Adderall, um, and it does kind of do the same thing that drinking did for me.
Mm-hmm.
And that is to unscramble the scrambled web that is my brain.
Mm.
I get things done. I feel more clear. I feel more productive. I get more into tasks that need to be done. Because when I'm not into it, that's when, that's when you see the depression side of things. Shit doesn't get done. Shit piles up.
Mm.
I'm not into it, so I just would rather sit on the couch or whatever.
No motivation.
Right.
Motivation. Oh yeah.
But I mean that's the long and short of it for myself. Um,
Mm-hmm.
a lot of folks here that watch the show, listen to the show. You write in your questions, which, by the way, let's take a second to go over the fact that we have our
Yeah.
live Q&A coming back
We
by
need
popular
to.
demand. Wednesday, April 5th. That's coming up soon. So get your questions in. I know we've had some questions trickling in.
Mm-hmm.
I have not yet looked at them. I like to be surprised. I like to answer. Gemma kind of
Well, I've
screens.
literally just checked before I came on. Just to
Gemma
see
does
what's
the
going
screening
on.
process and stuff. I like to wing it. That's why I like these shows, the live Q&As, because
Mm-hmm.
she'll read the question, and I've heard some of them, most of them beforehand. Like we'll talk about it the day before the show, but for the most part, it's the first time I'm processing and talking about it on the show is the live show. So I like to keep it kind of authentic like that.
I think
But-
it gives it a more authentic and from the heart response rather than a rehearsed,
right.
scripted reply. Yeah, I check them to make sure they're coming in, to make sure that we have everything. If by any chance there was one that comes in and we don't have as much knowledge, then yeah, I will go and get that information ready. But I'm the only one that see them prior to going live that day, and obviously I take out any names, I degender them so that it's not aimed at any one person, and just things like that. But I regularly check all the forms and things because we've had quite a few more show requests and things, and actually ADHD and autism was one of them that came through yesterday.
Oh, good.
So,
I mean,
that was a
these are
request.
things that, especially the ones that come through that I can relate to,
Mm-hmm.
which, I mean, in the past, there's been a good portion of them. Now, we do get some that I lean more heavily on Gemma for, or we both have to, we're we both
Yeah.
kind of have to look up some information ahead of time to make sure we're not putting incorrect information out there.
Yeah. Well, it's a learning process for everyone, and I think that's why this works well, because we're not professionals. We are just speaking from the heart when it comes to this and our own experiences, which I think makes it more authentic, because I would much rather speak to somebody who has been there, done that, lived that life and been through it, come out of it the other side, than someone who is trained there to sit there and give a script. Like, I really would.
And you do see it live here on the show too. Like
Mhm.
just right now, when I prepared for this show tonight, I was the whole time I was thinking about my depression and my substance use disorder. And then light bulb moment during the show right here, I'm thinking ADHD is more the culprit of my co-occurring disorders. If I had to rank them as far as why I would abuse alcohol, I think the ADHD takes far more of a front row seat than the depression. The depression definitely played a role. I don't want to downplay that. Drinking does what? Makes us happier. But does it really?
Mm-hmm.
In the moment, yes. You feel good. You feel happy. You feel like you can conquer the world. The next day,
Do you think that your ADHD made you more depressed? And then do you think, like, when you, I mean, I don't know what age you were when you got the diagnosis, but I'm assuming that you were aware of these things before, like, you had the diagnosis. And then when you got the diagnosis, like, did it seem to just, like, click, like, oh, now it makes sense kind of
when I
thing? Or
got
did
the
it make you
diagnosis,
depressed?
when I got it, I was young.
Okay.
I was a kid. Um, there was never really a moment where I felt, hold on a second, this is something that I really need to look into further. I just thought it was a part of life, like everyday life. I knew depression, that rings enough alarm bells that I either wanted to sweep it under the rug or not pay attention to it. I knew that was bad. ADHD, I didn't know it could cause this much trouble. I thought it was just a learning disability, hey,
Yeah.
you can't concentrate real well in math class. That's all I thought it was. I didn't know
Hmm.
the actual implications and what it brings inside of you, because it does kind of get, when you're not progressing as fast as others, and same with folks that have like dyslexia or things like this.
Hmm.
um, you get frustrated, and I mean
Yeah.
that in turn plays into all of the depression, anxiety.
Oh yeah, like I was diagnosed with dyslexia when I was in college, resitting my exams to go into doing teaching, and I didn't know what was wrong with me. I just People put me down to being basically an idiot, and I couldn't retain what I was reading. Like I was like, what was going on? And then when they finally listened to me, I had been like 21, 22 maybe. And when they finally diagnosed it and things, it was like, oh shit, I'm not sick. Actually, like
There's something actually wrong.
this is the real. Once they gave me ways around it, and then I worked harder still on a personal level to overcome it. It was, yeah, and I think some of that weight was lifted off because it's like, okay, this isn't me. This is a real thing.
Man. And the
And
hyperactivity, the H in ADHD, for those that aren't aware, is hyperactivity.
mhm,
Um,
yeah, the
that's
ADD as
that's
well.
fucking exhausting. Um,
Yeah.
and I probably have the biggest case of H um, known to man. Uh, I don't even need the AD and the other D. I got the H. Like I can't. If you know me, I don't. If Betty's still in here, I know she could probably speak to this, but um, I can't sit still at all. It's just completely uncomfortable. You watch me during the show, and you'll see me go back and forth and this way and that way, and touching my face and doing this and bouncing my legs and playing drums on the desk. It's ridiculous how much my body always has to be in motion in some way,
Yeah.
shape, or form.
Your leg's a good one, like always. You can't
It's
sit
going right
still.
now.
Yeah. Yeah.
Because for some reason that is a position of comfort for me. Sitting
Hmm.
absolutely still makes me feel uncomfortable and not like it's not right. I have to be moving in some way,
Hmm.
and that's the hyperactivity coming in, and it makes it difficult to concentrate. But then again, on the other side of the coin, I concentrate better when I'm shaking my leg. If I'm
Yeah.
not shaking my leg, all I'm thinking about is how uncomfortable this is. Like
Hmm.
if you're forced to try and sit with some sort of decorum, a funeral or church or whatever the hell,
Mm.
you're supposed to sit there. You can't just be flailing your arms around like a maniac.
Yeah.
All I want to do is jump out of my body and
Yeah.
just scream.
Well, you're concentrating so hard on being still that you're not actually concentrating on what you're meant to be concentrating on. I think Thomas is like that. I've got him those fidgets because you just
those are
constantly
huge.
got to be doing something. But trying to get him any kind of diagnosis, like, I feel like I've got more chance of winning the bloody lottery than I have getting him anything right now. But it is ridiculously difficult here, which is why I think a lot of adults have slipped through the net. And I think there's something there with myself, but I was never diagnosed as having anything. But I don't know. I often think when we were talking about it last time, like, it was funny because I had these phrases that I would use to refer to things that I do, like when you go and get something and your mind's focusing, and like I would say I'd had a snacksident, because you go and get something and then you're just having like loads of it and stuff, and like when you're trying to get stuff done and then I haven't done anything, and then I've not achieved anything, and then say somebody's like coming round or something, and I don't do tidy up, it's hidey up. Shove it in a bag, stick it behind a door somewhere. Tidy up. Yeah.
That's about, a lot of us do that. So I wouldn't get too down on yourself. It's
when the door starts bursting open though, and you're like,
there's a difference between actually cleaning and tidying up. Tidying up is tidying up. Okay. Mom's coming over. We got to get this place looking spick and span. Shit goes into closets. I don't think there's a diagnosable issue there. I think everybody in this room is guilty of it.
Pick up the
because
floor
we don't want to throw shit out just because mom's coming over. Like,
I don't do it for my mom.
I'm throwing an example out there. But like, I've got stuff right here in front of me that I can see that normally isn't sitting there. Like, I have my spiral notebook up here that I write notes down on for the day, things that I need to get done, or just, it's scratch paper. Normally I keep that in my drawer here, but it's out. Obviously I'm not going to throw that out because somebody's coming over to visit.
Yeah.
But does it wind up in the drawer where it's supposed to be?
No.
Not always. It usually, sometimes when you're just doing it quick, it goes into a basket, up the stairs it goes. We'll deal with it later.
Out of sight, out of mind, tidy up. Yep.
As long as we're good on the first floor here, I don't think she's going to go up to our upstairs bathroom and investigate. I know he's got a spiral notebook around here somewhere.
I found it's been beneficial actually, because I have a very difficult relationship with my family, and I found out it's only taken me 39 years to realize that if I don't tidy up, my mom don't come in the house, so that's a win-win.
But now, when it comes down to it, Craig, yes, there is time for cleaning, and that does involve throwing junk out. You have to get rid of some things every now and again, otherwise your life is just going to be a storage locker. But as far as just the quick cleanup, it's not time to sit and go through what's Goodwill stuff. I say Goodwill. I don't know that you even know what that is, Gemma. We have Goodwill here, which is like Salvation Army or
charity shops.
Yeah. Stuff we can give away for charity, or you make a pile for donation, you make a pile for trash, and then your keep pile or what have you. But whatever happens down the road for the tidying up thing, it always comes back to, okay, we need to sit down and go through some things because it's starting to get too full. And that is kind of a great segue to how that affects the depression and the ADHD for just the two we've been discussing tonight. Clutter amongst your living space depresses you. It does. Tell me, anybody in chat or anybody listening on the replays on any of the podcasting sites, think to yourself, when do you feel the happiest living in your house? Is it when you've just gone on a cleaning tear and everything looks like it's in place and it's organized, it makes sense, it looks good, you're proud of what your living quarters? Or is it when, a couple weeks have gone by or the holidays and things are piling up, you just had kids open presents, shit's everywhere.
Oh God, yeah.
You don't have, you're in a whole different headspace when your living quarters is mucked up, your brain's mucked up. So decluttering is an excellent thing that you can do, non-medicinal, just something you can do for you. It does in turn wind up falling into self-care by taking care of your home, your domicile, your living quarters. It will affect your mood in such a positive way. It's not something we realize until we talk about it and say, hey, that's actually fucking true. Like, I feel so much better when my house is clean and tidy. It's just hard to achieve that because we like all of our junk.
Yeah, that's the thing. Sometimes you have an attachment to some of it. Like, that's the problem I've got. It's about accepting that there's a lot of stuff that I used to do, like the DJing that I did and the teaching and things, that I know that I'm never going to be able to do physically anymore. But it's letting go of that attachment to it and that hope that maybe I will be able to, and just thinking, no, do you know what? My body's changed, life's changed. I'm never going to be able to do that. And it's a huge mental overhaul of trying to let that go from inside and thinking, okay, I'm going to have to let go of it. I'm going to have to move on from it. And it is really true, because right now my house is like, whoa, and it stresses me out. And I was the happiest I've ever been when I wasn't in this damn house when we went away, because it just, like, I didn't have to look at it all the time. And then I will get so depressed and end up doing nothing with my day usually, or going out of the house because I can't bear it, having come back then, not achieved anything, and then feeling even worse for it because I'm like, well, I've not done anything. But I've also got terrible chronic fatigue and things, which is exacerbated by the crappy weather and just feeling shit generally because of the depression, and everything is just impacting on you. And it's true what they say, tidy mind, tidy house, tidy mind.
Yeah.
And it's just constantly like, I haven't done this, I haven't done that, and I'm trying to get on top of it, but then it's like, well, where the hell do I start right now?
And then it overwhelms you and you get that depression set in, and then what the hell does it matter, and we'll just keep living like this, and then a downward slope ensues.
I think Rick should bring his empty garbage bags to the UK and come and help me out if he's managed to just get rid of 35 in a week.
He's the hell out of there. He said that life is behind him now.
Yeah.
Minimalist living. It sounds great.
Out of that, yeah.
Let's take a look at some slides before we we're on a good tear there, and the episode's going pretty well, or as far as time wise. Let's talk about who's affected by this co-occurring disorders.
Yeah, I'm just gonna pull those up. Right, okay, so who's affected? So it says 7.7 million adults have co-occurring mental and substance use disorders. This doesn't mean that one caused the other, and it can be difficult to determine which came first. Of the 20.3 million adults with substance use disorders, 37.9% of those also had a mental illness. And among the 42.1 million adults with a mental illness, 18.2% of those also had a substance disorder, or substance use disorder, should I say.
So we're not talking about a whole hell of a big number here. I mean,
Mm-hmm.
37.9% on the side of
That is a lot
those
of
with the
people.
substance use
Yeah.
disorder already
Mm-hmm.
having a mental illness. That's a decent number. But those with a diagnosed mental illness, we're under a fifth of these folks that actually also have substance use disorder or use substance in some way, abuse substance in some way
Mm-hmm.
that it directly correlated to their mental illness. Um, so I 100% most likely fall into the 37.9. I know my alcoholism was with me since birth. I know it's been there. Um,
Mm-hmm.
and it's on top of these other things. It takes the front row seat, obviously,
Mm-hmm.
because that will destroy me the quickest.
Oh yeah.
And it's already reared its ugly head several times. Um, Now, the depression, anxiety, ADHD, PTSD, etc., that I also deal with is kind of um, supplementing that
Mm-hmm.
substance use disorder. Whereas on the other side of these numbers, the mental illness is the one supplementing. I mean, the substance use disorder is the one supplementing the mental illness. Um,
Mm-hmm.
so, moving forward, what else do we have?
Okay, so co-occurring disorders and dual diagnosis. So 9 million in the United States have co-occurring disorders. So what is that? Dual diagnosis refers to a mental health issue co-occurring at the same time as an addiction. The cycle of self-destruction, so mental illness to substance abuse, increases the dependence and worsens the mental illness. And then common mental health issues leading to dual diagnosis: major depression, anxiety disorder, bipolar, schizophrenia, personality disorder, and PTSD. The unmet need for dual diagnosis treatment. So 37% treatment for only one disorder, 56% treatment for both conditions, and that's treating both the mental health and addictive disorder simultaneously is the most successful.
Absolutely. You have to address both problems.
Mm-hmm.
Um, Now, 37% get treatment for one disorder. That can fall for a number of reasons. We can be talking about not realizing there's a second disorder had. Uh,
Mm-hmm.
the first one is uh, far more apparent and needs treatment. Um, so we don't know there's two things happening here. B, there is two things happening, but one is so severe that we're only focusing on that. 56% getting treatment for both conditions. That number is great. I feel like we're looking at it. That's above half, right? So that's a W in my book. We're
Mm-hmm.
finding these things. We're getting both of them treated. Things are looking good there. But there's the fact of the matter remains is there's still 37% that aren't getting treatment for both.
Mm-hmm.
Now, Also, does that have to do with insurance? Are we treating alcohol abuse because AA is free and we're not treating depression because we can't get coverage from our insurance provider?
Mm-hmm.
Um, so that just gets thrown to the back. Maybe we are aware of it and it's just not getting treatment because we don't have the coverage.
Mm-hmm.
And we're doing AA, so we're doing something, right? Uh, there's a number of reasons for not being able to treat both um, disorders at the same time.
And it'd be like here, I know that we have the NHS here, just to refer to those that are UK based. But the problem with that would be that those are from different departments. So you would go to one department for addiction and another one for depression. It's not necessarily going to be the same person down the same track.
Yeah.
And that's the problem I had. I had eating disorders and things in one way. I had self-harm in another way, and then my depression in another way. And it was like every single bit of you is tracked differently. It's like when it comes to any other physical problem, like when I've had my surgeries and things, the problem is that every department is different. Like say the colorectal and the other parts of things that I've had, and it seems that the communication between like doctors and things is pretty scarce, if at all, and that can affect the person's treatment where there's no communication or a lack of communication between medical professionals, which doesn't always get you put in the right way. So the treatment to have both, not easy.
Yeah. Yes, indeed. And then let's hit this last slide here. It's again another treatment look at. I wanted to throw another option up here or another look at it.
Okay, so who gets treatment? There are many effective treatments for both mental and substance abuse disorders. A comprehensive treatment approach will address both disorders at the same time. Not everyone with co-occurring conditions get the treatment they need. So this pie chart here shows that 52.5% received neither mental health care nor substance use treatment. That's a hell of a lot. 34.5% received mental health care only. 9.1% received both mental health care and substance use treatment. And 3.9% received substance use treatment only. Those numbers are...
Yeah, so I saw this and I wanted to include it because it kind of looks like it goes against our first pie chart, where the overwhelming amount. This is more of a look at the overall picture as far as treating. The first pie chart we looked at, I feel like looked more at people getting treatment. So of those polled, we are treating at least one of these disorders. Now we're looking at a pie chart that includes everybody, people that aren't getting treatment at all, and people that are getting treatment for one or the other or both. So that's why I wanted to bring this one in as well, because it shows another look at it. Like I said, the first one, I feel like everybody was receiving treatment that was polled. Now, and the question now becomes, well, while you're receiving treatment for one, are you getting treatment for the other as well? This one just encompasses everything. Are you getting treatment at all?
Yeah, and that's a huge amount of people that are not. And I would have thought that the substance abuse treatment and the mental health treatment only ones would have been the other way around. Especially when you consider like what you said about insurance and things. And because I would have thought that a substance abuse treatment is potentially easier to diagnose, although it's more of a case of getting to the point where they want to, I guess.
And Craig says, and the 100% here can only be of those who have actually been diagnosed.
Yeah.
So, yes, a medical diagnosis is important to the process of treatment. 100%. I mean, especially if it's something like ADHD, you need a doctor's diagnosis, and then you need a doctor's prescription for the ADHD medications because they are controlled dangerous substance. Just like trying to get painkillers, these drugs can be you could be arrested for misusing or selling or carrying illegally without a prescription, etc. So it's a whole big thing that requires an initial diagnosis. While we look at the big chunk there, 52.5% receive neither mental health care nor substance. It goes back to, as you were just kind of touching on, are we aware of the disorders that need treatment? Obviously, I feel like the people polled for this have some kind of diagnosis. Because why would they be polled in a poll for substance use or mental health treatment without a mental illness? That number can kind of be thrown away if you don't have a diagnosis. Then you're probably not included in this survey. I would hope that. I mean that was from the where was it? That was from the National Institute on Drug Abuse and NIH. So I mean,
reputable source.
They're not going to be polling just everybody.
Yeah.
So it brings back to: are we aware of treatment opportunities? Are they available? Whether it be insurance related or not. Maybe it's a location issue. Some people live in the mountains, half hour away from any kind of doctor's office and or treatment center.
Yeah.
Telehealth has come a long way, and that is to COVID-19's credit. COVID-19 locked us in our houses, but it did improve on the way we receive telemedicine, or even just not having to sit for 45 minutes to wait for a haircut anymore. You can COVID's not really as prominent now. You can walk out, you can go out in the public, you can go get your haircut. You don't need the scheduled appointments anymore, but we kind of stuck with that because it was more efficient now. I can get on my app and check into my haircut place, and I can walk in just like I did. We don't have to wait on that shit anymore. So
COVID sound a little bit more advanced there then.
COVID-19 did have some good come out of it. We have streamlined a lot of things because of it. And telemedicine or telehealth has been one of those that have seen leaps and bounds progress. But sometimes that shit just isn't enough. It's great for group therapy or AA or, just a quick doctor's visit for something that doesn't need to be seen, felt, touched to be diagnosed. You can do just a quick wellness check or a prescription medication refill over the internet now.
And that's a good point, what Craig's just mentioned. Counter to that, will a depressed person even bother to seek telehealth? See, I wasn't diagnosed as depressed or having depression because I specifically went to my doctor about my mental health. It came secondary to another appointment that had nothing to do with my actual health. So there is still a lot to be said about having a face-to-face appointment. And I don't know what it's like there, but I feel like here especially, they are too used to having over the phone appointments where they don't have to have people coming in, that they liked it that much. They don't want you to come in anymore. And I certainly haven't rang up and made appointments or discussions about a lot of things that I maybe should have, because
Oh
I'm like,
yeah,
what's the point? Because they're not going to see me anyway.
I was never
So,
interested in being seen for my depression ever.
yeah,
'Cause I didn't
yeah,
think it was real. I didn't think it existed. I'm
yeah.
a happy-go-lucky guy. I'm not. There's no way I'm depressed. But
Mm,
depression does also keep us from accomplishing things, and yeah, that can definitely. I don't know that the standard depressed person would seek help in the beginning.
yeah.
I think it definitely weighs a lot on
Hmm.
needing help for something else to bring that depression to light.
Yeah, definitely.
Um, so yeah, I mean, there's co-occurring disorders. We'll probably touch on this again because we're running out of time tonight. But
Hmm.
it is a very good topic, and it does make me want to explore it a little further. So stay tuned on that. We'll go ahead and put a bookmark in it tonight. Uh, we do have to start wrapping up and getting out of here. I want to do some community calendar, and then I got to feed the baby. Um, so overall, what did we take a look at? What did we learn? Uh, Normally, co-occurring disorders are a substance use disorder coupled with a mental health illness. Um, that's normally the case. It can be two things working together. I would say depression and anxiety are co-occurring in most people, um, but that's the bulk of the what it is. And then we looked at some treatment options, and I mean, who's receiving the treatment. Um, so we will definitely touch on this again. Let's get into tonight. We have our good friend Jim in Chicagoland doing Catalyst. Catalyst.
There we go.
Catalyst with Jim every Wednesday night here, 11 p.m., 10 p.m. Um, somewhere in the 10 to 11 o'clock hour. Uh, Ray and I have been joking about it because we try
As
and
I say, it says
time for
10
it.
p.m. on the
Catalyst
intro.
has its own time frame.
Yeah.
But it's a great show, and we'll see everybody there tonight on Jim's Twitch handle. It was up there shortly, or it was up there a minute ago. Ray, of course, our good moderator here tonight. Thank you, Ray.
Yeah. Thank you, Ray. Done
Taking
a
care of
cracking
throwing
job.
down the helplines and whatnot. Um, check his show out. We got to change this. I keep saying that, but I keep forgetting. It's Tuesday nights. Is the new season he's doing of A Ray of Sunshine. Positive stories, positive vibes. Get on over, give him a follow, and check it out. It's a great show. Eric also was not here tonight, I don't think. I don't know if I saw
No,
him.
I've not seen him.
But he's on. He was a previous guest of ours. He's on every Monday night. Give him a follow and a check out. And then Gemma as well does her own thing over there. She's been cooking and baking and crafting and arting and all kinds of good stuff on
All
her
the
channel.
arty party stuff. Yes.
So give her a follow as well. And then, of course, for all things bunny, check out our favorite bunny mom, Ella. You can catch her on Twitch streaming live late nights for some music and some ukulele practice and guitar practice, and she'll play you a song. She does very well, has a good following. And you can hit up her website at mybunnyvalentine.com. Use the promo code FireDude15 to get 15% off your order. And that is all I've got. Other than us, And our live QA.
Yeah, please
we've
do
already gone
send
over
the questions in. I've made it so you can send them in multiple different ways. The form is the best because it's anonymous. Keep it like on topic and appropriate, obviously, but you can actually send them in via the Instagram stories that I've been posting out if you're not bothered about being anonymous to me who checks them. Obviously, I would never ever say who sent it. Whether you give me your name or not, I'm not going to do that. I will keep it anonymous all the time. But yeah, it's another way you can send it in, or just message me on the Discord if you want.
the Discord. There it is.
There.
All right. We will be back again next week. We've got an all new topic. Next week isn't the thing.
It's the
2 weeks from now.
women's one next week.
Yes, for Women's
It's
History Month.
Women's Month.
Women's History Month is the month of April, so we're going to top off our last show of April. I'm sorry, March. What am I thinking? March.
A month ahead.
We're going to cap it off with our show on women and mental health.
Yeah, women's stigmas and mental health.
So we're gonna lean on Gemma. It's gonna be a Gemma show next week. Yeah. All right, guys. We'll see you guys at Catalyst later. And thank you for tuning in as always. Check out the replays on our YouTube channel. Join the Discord. We'll see everybody back here next week. Bye now.
Bye.